Today my topic is the clinical differentiation between fibromyalgia and myofascial pain syndrome. So what is fibromyalgia? The fibromyalgia syndrome and the myofascial pain syndrome both almost look similar, but there is some differentiation is there. So this is like a group of chronic non-inflammatory pain syndromes. This affects the muscles and the tendon insertion also. There are some criteria of diagnosis both the diseases in the presence of the tender points and the trigger points. So both are different, but clinically sometimes this terminologies will be misusing that tender points and trigger points. So according to the ACR criteria of fibromyalgia FMS is characterized by the presence of the tender points. But where is the trigger points? This typically found in myofascial pain syndrome. So there is a literature supports the fibromyalgia and myofascial pain syndrome. This starts from almost 1985 onwards. It is there. So there is a criteria of the differential diagnosis the presence of the tender points in FMS, fibromyalgia syndrome, and this non-specific and soft tissue pain, and the presence of the regional and characteristic referred pain. The muscular trigger points, it's like a taut band. So there is when we palpate that, there's a taut bands will be palpated on the skeletal muscle. So that is there in the myofascial pain syndrome. So what is the difference between tender and the trigger points? So the etiology of the tender points, it is not still unclear that. And there is a certain which specific soft tissues are under the fibromyalgia patients. So there is a myofascial trigger points that's found within the taut bands of the skeletal muscles. That's called as a nodules. Okay, when we palpate, we can palpate the kind of the nodules. We can feel the nodules or the taut bands also. So that's called as a nodules textures in the palpation. So that is a trigger point. So when you apply the pressure in that particular the spot, the patient will shout. So it's a triggering the pain. That's what the trigger point. Tender means it's a generalized. All the points everywhere will apply the pain pressure. The patient will here pain. All the places the patient will come and there is a pain. So it's a tender. So it's a tender point. So what are the signs and symptoms of myofascial trigger points? So there is a palpable nodules. It is often located close to the muscle belly. Where is the muscle belly fibers? The muscle belly is there. So in that area will be there. Mostly it will be often single. Sometimes one trigger point will notice it may be located just nearby, but that may not be that much triggering the pain. And there is a allodynia and hyperalgesia of the myofascial trigger points. And the trigger points, when there is a referral to the myofascial trigger point, one particular spot, if you apply pressure, so there may be the refer, it will be extending that place also, and around the place also the pain the patient will get. But it's originating from that triggering, the spot. So there is a normal pain sensitivity outside the myofascial trigger points also. And there is a local twitch response. Sometimes when you apply the pressure, you can feel there is a twitch response and followed by the local contraction also. Commonly when there is a dry needle, if they put on the trigger points, so there is a twitch, easily will be visible that. So there is a twitch response when you apply the pressure or the things, so easily twitch response and the contractions. So local contracture in the biopsy materials. Okay, and there is a peripheral mechanisms. There is a probable peripheral mechanisms also in this myofascial trigger point. So what are the signs and symptoms of tender points? There is no palpable nodules. Location will be often very close to the muscle attachment, where the muscle attached to the bone, and that attachment site only that pain will be there. And there is a multiple by definition. Everywhere when you apply pressure, the patient will say, everywhere I'm getting the pain. Okay, and there is allodynia and hyperalgesia will be outside that tender points, not on that area, outside that. And there is a pain under the psychic stress. The patient will be the stressful in nature. Definitely that anxiety and the stress that will aggravate the pain. And this is unspecific histological changes in the biopsy. In the biopsy also is there nothing, you can't find out anything. And central nervous mechanism. This trigger with and this will the condition will be aggravated by the central nervous system. There is electro-diagnostic evidence source also. The differentiation, tender points and triggers, mostly the past studies also. It has been evaluated this electromyographic activity of myofascial trigger points. Uh, so there are kind of evidences shown that, and there was no points and trigger points are associated muscle bands. So there is no electrodiagnostic evidence on ongoing that denervations or the focal muscle spasm that is also found associated with the myofascial pain syndrome or the fibromyalgia. So these are all the kind of evidences, the references is also given. So there is central sensitization. The central sensitization it plays an important role here in both the fibromyalgia pain syndrome. So central sensitization phenomena in fibromyalgia, this will be explained the patients with the fibromyalgia, given the pressure and the healthy individual. So it is unique in the fibromyalgia. This occurs in the painful conditions like irritable bowel syndrome, overactive bladder, TMJ syndrome, idiopathic low back pain, multiple chemical sensitivity. Okay, so these all the things will be have associated in that. The symptoms are currently believed to be the result of disturbed brain functions, and there is abnormal pain processing and autonomic nerve systems also, and ANS dysfunction in fibromyalgia. So in the fibromyalgia, the patient will have in the stress condition, and even the autonomic dysfunction also will be there. So which will be triggered by central sensitization. So central sensitization in fibromyalgia, this will be understood easily by the direct imaging of the brain. The rest, or there is a shortly after the application of the painful stimulus. So both in the rest position and once the pain stimulus is given, again there is a brain imaging has been taken. So this brain imaging is a 99 MTC ECD brain perfusion. So this is what will be taken that. This reported that the fibromyalgia patients had increased activity in some areas of the brain. There are certain areas of the brain, there is activities will be increased. So which area of the brain is activity has been increased, and that corresponding the place of the peripheral area. For example, like sensory cortex. Sensory cortex. If there is the shoulder area of sensory cortex has been overactivity, hyperactivity is there. So patient may get the pain on that shoulder and the musculature, in and around the shoulder and neck musculature. So in the frontal, cingulate, and even there is a medial temporal, and there is a cerebellar cortex. So this will be exposed after the pain stimuli. Also again they have taken this scanning. The scan are shown. This scan are shown that below orange, yellows areas, and this all have increased activity. This compared to the healthy individuals. And there is a blue area, this represents decreased brain activity. So this is what the activity of the brain. I'm enlarging and showing that. Yeah, this blue colors where it has been shows. So this is a decreased brain activity. This is yellow color, increased activity of the brain. Some areas so there is a orange color. So this orange color and the yellow, the color this represents there is increased brain activity. So this area of orange or yellow colors corresponding the part, extremities or in the spine, or if it is there on the hamstring area or the leg, okay, the patient will get the pain. And this central sensitization, when the patient get anxiety or the stress, definitely the pain also will be aggravate. So this is what the brain activity. So this activity of the brain, this corresponds with this myofascial pain syndrome. So this is what magnetic resonance elastography next one. So there is a magnetic resonance elastography. These are used to assess the taut bands of the skeletal muscle. So there is an experiment also has been done. This performed a 1.5 T magnet resonance imaging scanner. So this shear wave propagations was imaged, and there is a shear stiffness was it's a reconstructed using the matching. And there is a magnetic resonance elastography. This may have a potential for objectively, there is a characterized myofascial taut band. So we can also easily catch the myofascial taut bands. And once the taut bands has been detected, and that can be palpable. And mostly that what is the size of the taut band and how thick it is there, this can be detectable by the clinician's finger. So what is the fibromyalgia and the myofascial pain syndrome? So commonly this women suffer with the fibromyalgia than men, because women's anxiety role is more than the men. But the ratio of men and women is equal in the myofascial pain syndrome. So in the myofascial pain syndrome, can see the taut bands. Okay, so the mechanism is on the peripheral. And fibromyalgia, the mechanism is it is not there here; it is in the center. So in the fibromyalgia, the muscle have generalized hypersensitivity, while in the myofascial pain syndrome, the muscle have the muscle area located away from the trigger points. So usually that will be the normal sensitivity. In and around that area will be normal sensitivity. So with the fibromyalgia, there is a total body ache. Everywhere the patient will get a pain. So all the places, the patient will say here, 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 all the extremity. Even if you touch the neck, then the patient will say here also is there a deltoid region, biceps, all the places. So throughout the body, the patient will get a pain. Reason, there is no peripheral cause. This is central mechanisms. Because of the central sensitivity only, that patient will have pain. And patient will ask physio to keep everywhere that IFA also. So that is also not possible. That, and we are trying to understand what is that. Why the patient is complaining everywhere there is a pain. So the myofascial pain. So there are the specific pain in specific areas. So that's for myofascial pain syndrome. The particular that one area, there is a patient complaint where we palpate. You can feel the taut band. Once you apply the pressure, patient will shout. So that's which reproduce the pain. So the patient sometimes will feel the jerky pain. So other than that spot, the taut bands, when other places if we apply the pressure, no pain. And with the myofascial pain, the area is not affected by the trigger points and don't hurt. But the fibromyalgia, the area outside the trigger points is still an ache. So this is a differentiation. And fibromyalgia is it's a neuroendocrine disorder, and myofascial pain syndrome is a neuromuscular condition. So the patient who come with a whole body pain, and definitely there is a fibromyalgia. It's not a myofascial pain syndrome, but the terminologies are often it is misused. So fibromyalgia like that. So the patient who have fibromyalgia, so on the locally on the peripheral area, whatever we apply in this, even when you apply IFT, ultrasound, any other mobilization, soft tissue mobilization, will never that much work on that. But the patient who have myofascial pain syndrome, yes, there is a taut band. Yes, we can apply all the things. But other differentiation, there is a sleep disturbances usually occur in both the conditions, both because of the pain. But in fibromyalgia patients, as the patient is already in the depressions or the anxiety, so definitely the sleep disturbances also will be there, and the pain also will not allow the patient to sleep properly. So in both the cases, there is a fatigue will be common, and due to lack of the less sleep, and there is a fibromyalgia, there is due to the neuroendocrine imbalance, and myofascial is due to the pain. So because of neuroendocrine imbalance only, the patient will have sleep disorders in fibromyalgia. But in myofascial pain syndrome, it's because of the pain. So there's a taut band. So once the band shrink, okay, constrict, the nodules also will increase. So patient will get a pain. So muscle function will be reduced. So patient will get a pain. So there is a cognitive defect that also will be there in fibromyalgia, and also in present myofascial pain syndrome also. But commonly this kind of cognitive impairments, the deficits, so that will be more in this fibromyalgia. Even there is a proprioceptive dysfunction and autonomic dysfunction also will be present in the fibromyalgia. So there is a deep aching and there is a burning pain in the fibromyalgia will be there, and is different than the pain of the multiple trigger points. So if there is a trigger points, if it is at that spot only will have a pain, but other than remaining everywhere, the patient will get a pain. But commonly this kind of fibromyalgia patient will complain that I have a burning pain. Okay, my full upper extremity is burning, my lower limb is burning. So all the part of the muscles, full lower limb, I'm get a pain. So these all the things are complaints of the fibromyalgia. So it is possible to reduce trigger point pain by the many of the conservative therapy. There are many conservative treatments on there, even soft tissue mobilization, stretching of the muscles, even kind of ischemic compressions, drain needle therapy. There are so many other conservative therapies available to reduce the trigger points. But there is a pain with the fibromyalgia, severe fibromyalgia. So the problem is not on the local. The problem is not on the muscle. Problem is not on the skeleton. The problem is on the central. So patient may not want to touch the single sheet. Okay. So even if you touch one place also, no, the patient will not be satisfied. So here also I have pain. So patient will keep on tell all the places. Everywhere if you apply the pressure, again the patient will complete another new point. So the as it is not a trigger points, okay, as you the therapist is not feeling the trigger points, if the whole limb if it has been paining, so definitely it is not a trigger points. So this is what finally what I am going to discuss here is the central sensitization is the important phenomena of the tender points patients have the fibromyalgia. So fibromyalgia is a systemic disease process. Commonly this affects the dysfunction of the limbic system and the neuroendocrine problems. The patient have a neuroendocrine dysfunction also, and the autonomic dysfunction also will be present. And there is a patient need a treatment approach like psychotherapy will be required. Even the patient need a counseling, psychological treatment also will be required because the problem is on the center. So there's a low dose antidepressant medication also will be prescribed for this kind of patients, the patients who have the fibromyalgia. And even the exercise program will be that mild to moderate exercises program will be given. And myofascial pain syndrome, the condition arises from the referred pain, and there is a muscle dysfunction. This problem is in the peripheral, there is not in the central. So there is a dysfunction of the muscle only. This is caused by the trigger points. So once it's been released, the trigger points are the thing. Once you give a stretch the muscle, when you regain the muscle function back, so patient will come back from the pain. So there is a manual treatment method, ischemic compressions, various other treatment methods, stretching techniques is available. Ischemic compression, drain needling therapy, all the things will be available. Even chiropractic practices, so that also has been available. So these all the treatments, conservative therapy will definitely reduce the myofascial pain syndrome and reduce the trigger points also. So these are my references of trigger point and tender point differentiation. My idea of the presentation is mainly as a physio, we are supposed to differentiate the tender points and the trigger points. First, number one, the patient who is complaining the whole body, the pain, many times we will be goes with the particular every area, all the place of the thing will be considered for the treatment. So which will not be required. We have to direct the patient to go for the psychotherapy and psychological psycho counseling also. Okay, so thank you very much.